place, and they're going to require speech therapy as part of their inpatient or daily skilled services. The daily skilled services are typically going to be provided either in a skilled nursing facility or an inpatient rehab. Skilled nursing facilities are going to provide that level of nursing intervention or therapy intervention at least 5, maybe 6 times a week. If we're really lucky, they might get it 7. Inpatient rehab is going to be a much more intense level of care. They're going to get that on a daily basis, and they're going to have physician supervision along with the therapy services. Physician supervision both for medical and for therapy needs. And what I'll go through now are the requirements for inpatient rehab. And it used to be years ago that we would see that young 50 or 60-year-old, they had their total joint done, they're going to go to rehab because they don't really want to go to the nursing home, they're going to be in and out in 5 days, and that would be covered. We don't cover those type of patients anymore. They don't really meet the criteria that were established for what inpatient rehab was designed. It's designed for those people that have some level of medical issues that need closer supervision, and they need a real complex level of therapy that needs to be integrated. And that's why the teams on these inpatient rehabs meet on a weekly basis and go over what the goals are for these members, whether they're reasonable, or these patients, whether they're reasonable, and are they getting the progress that they really need to go ahead and achieve. So you'll see as we go through these different criteria that there's ands after each one. It's not just this or that or that. It has to be, each one of these criteria have to be met in order for them to qualify for coverage in admission to an inpatient rehab facility. So like I said, they have to have some medical or condition or an exacerbation of a condition that cause their functional ability to significantly decline. They need to have some medical condition in association with their functional needs that's at risk for deteriorating, and so they need that medical supervision more so than what you could get at a skilled nursing facility. You have to have the physician on site that's going to be able to make rounds and see them at least 3 or 4 times a week. They require multidisciplinary therapy. So they need physical therapy and occupational therapy and speech therapy. They have to be combined in order to allow them to progress to a level to overcome their functional deficits. They have to be obviously strong enough to participate in this, and the participation is going to be a little more rigorous in that there's going to be multiple therapies on a daily basis. They have to be able to be mentally and physically able to participate in the various interventions that are being prescribed by the supervising physician. And they have to have some expectation of improvement. If somebody was in a coma before they went into the hospital with their acute problem and they're still in their coma, they may not be the most appropriate person to go to rehab because there's not that expectation with their prior illness that they're going to be able to benefit from that level of rehabilitation. There has to be that expectation that there's going to be a significant improvement. We want to see that usually within the first 1 to 2 weeks, and we're looking for that as when we do our reviews. We're looking at